Hello and welcome to today's Here's to Your Health podcast. I'm your host, Don Linsman. My guest on the podcast today is Dr. Elizabeth Ranniger. Dr. Ranniger is a pediatrician here at CCMH. And Dr. Ranniger, thank you for joining me today.
Thanks for having me.
You know, the occasion for our podcast today, last time we talked about back to school physicals, but today we're going to talk about some special recognition for you from our Press Ganey surveys that we send out. And first of all, let me offer my congratulations as well. I missed that celebration. I'm sorry for that, but congratulations.
Thank you very much. I was quite surprised.
Yeah, so first of all, the question that people are going to ask is, what is Press Ganey? And maybe you can fill us in a little bit on that.
Yeah, so Press Ganey is a company that basically does some standardized questionnaires that are sent out to patients after their visits. So whether it's a clinic visit, a med unit visit where you're admitted, ER visit, etc., you get this questionnaire that asks you about your care and asks you, do you feel like you were listened to? Do you feel like you were able to be a part of your care as the patient? Do you feel like you were treated appropriately? All those things. So it asks you a bunch of questions about how satisfied you were with the visit.
Absolutely. That includes things like wait times. Was your nurse or other provider happy? Blah, blah, blah.
Correct.
Right. And we encourage people to fill those out and send those back, because this is how we end up getting these scores from the surveys that allow us to celebrate people like Dr. Ranniger. And the occasion for our celebration is that in the last 2 years, you've been in the 90th percentile, and for the last 18 months, you've been in the 99th percentile, yep. Which means that you're 99% better than everybody else who's out there. Well, to be honest, you can't get to 100.
Okay.
So, but 99 is pretty darn good. 99 is pretty darn good. So, why do you think that is? What do you think makes you different? What puts you in that 99th percentile? And not to put you on the spot, pat yourself on the back or anything.
Yeah.
But I do think that there are certain aspects of the way that you practice medicine that lead people to know you, like you, and trust you.
So I guess I would probably first say that, I'm a pediatrician, so all of my patients are children, and I adore that part of my job. I really do. And you get to meet families in their worst day or in their best day, and you try to help them navigate the system and navigate, how do we help your child? I think being a mom, it also helps me relate to families and understand, why is this parent stressed about this? Or, what are we doing talking about, said question, right? Because as a mom, things change.
Do you think your own experience as a parent informs your practice when you talk to other parents?
Absolutely. I was a pediatrician for probably 3 years in practice before I had my kids, and that is the best training you'll ever get, is having children, to become a pediatrician, because it teaches you all the little things that you were never taught in school. So you learn a lot about physiology and medicine in school, but then you have kids and it throws you for a loop, as you know.
Yes,
so.
I do know that. We do have several, not at our house anymore, but we had them for quite a while. Some a little bit longer than others.
There you go. That happens.
Absolutely, it does. Well, I also think it from the standpoint of patient care, allowing patients to advocate for themselves and ask questions is a very valuable part of that experience.
Absolutely. I try to listen as much as I can to what patients are trying to tell me, and if it's not immediately clear to me what they're trying to tell me or ask me, we just try to delve into it a little bit deeper. What's going on today, and why are you here? What can I help you with? Really, medicine is about a relationship between you and the family, or you and the patient. For me, it's both. So, it's a huge honor to be asked and allowed to take part in the care of a child, because that means that a family trusts you enough to be able to do that. So.
I want to thank you for listening to the Here's to Your Health podcast today. I'm your host, Don Linsman. My guest is Dr. Elizabeth Ranniger, a pediatrician here at CCMH. We're talking about Press Ganey scores and our celebration for her, 99th percentile for the last 18 months in scores, which is absolutely amazing. Means that your patients like you a lot.
Well, I like them too.
but one thing that you did say last week in your email back to staff after our celebration, had to do with your support staff, because the Press-Ganey scores are also characterized by wait times were you greeted appropriately, did the nurse show the amount of care and concern, and so on and so forth. So maybe you can talk about that for a second as well.
Absolutely. First and foremost, I have a primary nurse, Nicole Dehner, who we've been working together as a pair for probably almost 8 years now. And you wouldn't find a better, more seasoned nurse. She is amazing at her job. She loves kids, and it just shows. I mean, every family that comes in adores Nurse Nicole. So I could not do my job without her. 100% could not do my job without her. And then there's the pod staff in the clinic. We just switched to a pod system over there. So I have 5 or 6 nurses and clinic staff, patient access representatives who work with me. And again, my job would not be possible without all of these people. Interpreters, nurses over on the floor, pharmacists, lab, EVS staff. I mean, I couldn't do it without them. This is such a team here at CCMH, and it really means a lot to me to get this award, but it also goes to show that they're doing a great job as well.
And I think you make an excellent point. This is a team game.
Yep, it is.
There isn't anybody who succeeds in this building without a whole lot of other people standing around them, beside them, behind them.
Yep.
Because this is how it works, and it actually begins with our patient access staff.
Yep.
Because they're the ones who help make the appointments and get everybody appropriately scheduled and all those kinds of things.
Absolutely.
So let's talk for just a second about how we use these scores. And just in case anybody is wondering and say, well, it's great that we're talking to Dr. Ranniger today, but how do we use these scores? How do we share these scores? And perhaps you can talk about your experience with medical staff and how those scores are shared.
Yes, so probably the first avenue that we see them as providers is in it's sometimes monthly, sometimes quarterly meetings with administration. So kind of like a performance or peer review type thing, where we go over our Press-Ganey scores from that month or that quarter, and go over any patient complaints or comments that they want to highlight. We are able to see our scores as well as the scores of the front desk patient access people, our nurses, etc., to see how it all flows together. Like, was there an area that we need to improve on specifically, or is it just overall that we need to improve? And so that helps us as providers, and then everybody else involved, come up with ways to enhance your experience as a patient. Do I need to work on my timing? Do I need to work on listening to patients better? There's all sorts of different questions that you can focus on, and so that's why we like that.
Yeah, and it's usually, those are process questions, and
yes.
I think that we're always looking to get a better process.
Yes, yep.
Build a better mousetrap. I would be remiss if I did not recognize that there are, as you said, you're a mom, got a husband. Yep. I recognize no matter what field you work in, yep, it's pretty demanding, but let's face it, a medical field is perhaps one of the more demanding fields that you could be in, and so you could not do this, in my guess. I'm just going to guess now because I know your family, but I'm going to guess you couldn't do this without their help and support.
I absolutely could not. My husband, my kiddos, they sacrifice a lot for me to have this job as well. And they put up with some late nights and that kind of thing here and there, but they also just support me through it. And, I have amazing in-laws. I have amazing parents that really have been behind me from the beginning. I wouldn't be where I am without my entire family. So,
yeah, medical school isn't a 3-year deal.
No,
if you know what I mean.
The number of times my mom had to listen to phone calls about me crying on tests or crying about.
Absolutely, it's not easy to get to where you are today.
Yeah.
And yet, I think that's a real testimony to not just your intellect, but it's a testimony to who you are as a person, because this is not possible unless you are the kind of person who is willing to listen to people and have some empathy and some sympathy for what they put themselves through.
Thank you, Don.
And that's what this award shows. And I am so glad and grateful to be able to have you for a guest on the podcast today. So thank you so much for joining me.
It was an honor to join you and an honor to be recognized for this. I really appreciate it.
My guest on the podcast today, Dr. Libby Ranniger. Dr. Ranniger is a pediatrician here at CCMH. She would accept new patients if you're willing to do that, so you can give her a call at 712-265-2700, and I'm sure we can figure out a time for you and your child to be able to have some time to come see her. I'm your host for the Here's to Your Health podcast. I'm Don Linsman. Thank you for joining us today. Have a great day.